Welcome to the ASPEN video series on medications via enteral feeding tubes. This video series is a collaboration between ASPEN and the University of Rochester Medical Center. This video series was developed by ASPEN workgroup members listed on this slide. This is video for preparing and administering medications for feeding tube delivery. I am Dr. Sandra City, and along with my colleague, Dr. Carol McGinnis, we will be covering the nurse caregiver role in preparing, administering, and documenting medications for feeding tube delivery. The learning objectives for this session include the following. Number 1, explain the elements of medication orders via feeding tubes that should be reviewed. Number 2, articulate and demonstrate the proper way to prepare the various forms of medications for feeding tube delivery. 3, describe the steps for proper medication administration via feeding tubes. And 4, discuss monitoring parameters needed to evaluate and promote the desired effect of the medication. Perform medication order review to ensure that the medications on the medication record, MAR, or medication list are accurate by name, dosage, frequency, and route, and there are no duplications. For instance, at times the medication may be ordered by the oral route, but it is actually to be administered via the gastric or jejunal feeding tube route, or the same medication is ordered by two different routes. If the patient has a gastrojejunal tube or GJ tube, determine whether the medication is to be administered via the gastric G port or the jejunal port, J port. Check for medication allergies, question and clarify any orders that appear inaccurate or warrant additional review. See whether any medication can be safely taken orally. The gastric route should be used for medication delivery if it is safe to do so. Pair and administer each medication separately. Medications should not be mixed together in order to prevent drug-drug interactions that can interfere with the intended therapeutic response, or they may form precipitates that may clog the feeding tube. Medications should not be added directly to the feeding tube formulas to prevent drug-nutrient interactions and may not immediately be administered to the patient as intended. It is important to ensure that the full medication dose is being delivered to the patient with the intended therapeutic response at the right time. There are additional resources on medication delivery via feeding tubes. Besides the list of references at the end of this video, some other online resources and database should be kept in mind. Ensure the proper form of medication, route, and size of feeding tube prior to administering medications via feeding tubes. Ensure the medication form is approved for feeding tube administration by the prescribed and intended route, either gastric or jejunal. Be aware of the exact type of tube and the tip location for the individual for whom the drug is being prescribed. Feeding tubes with smaller French sizes and longer lengths heighten the risk for tube clogging, for example, nasal inserted tubes or jejunal tubes. If the G tube or G port is used for venting along with the medication delivery, it will need to be clamped for a predetermined period to enhance the ability for the medication to make its way to the intestines for absorption. Medications available as liquids or suspensions are frequently formulated with sorbitol or other sweeteners and flavoring agents, making them palatable for oral use, but may result in a high osmolality. Liquid medications greater than 600 milliosmoles per kilogram may delay gastric emptying and cause GI discomfort, cramping, and diarrhea. Liquid medications may also include thickening agents, increasing viscosity and raising the risk of tube clogging. Diluting them with at least 1:1 with purified water may lessen GI side effects and tube clogging risks.
Medications that are modified release, for example, delayed release or DR,
Extended release or ER or sustained release SR or enteric coated are not to be crushed because crushing may result in the release of excessive doses and produce drug toxicities, variable serum concentrations, and potential severe effects, including fatalities. However, some modified release capsules that contain enteric coated granules are approved for feeding tube delivery when dispersed in a pH adjusted liquid. For example, some medications require acidic liquid to prevent granules from sticking together, and some medications require bicarbonate to dissolve enteric coating. Direct visualization is recommended prior to administration as granule size may be a limiting factor. A dosage change may impact the size of the granule. Film coated tablets may increase the risk of clogging the feeding tube. If ordered, tablets need to be completely crushed and dispersed sufficiently with an adequate amount of purified water just prior to administration, followed by a thorough flushing of the tube. Be on the alert for film coatings. It may not be immediately apparent that the drug has a coating. Contact the prescribing provider or pharmacist if there are any areas concerning about film coatings or concerns about potential clogging of the tube. Consult with the pharmacist or ordering provider to see if any liquid forms of medications can be used for patients who require enteral tubes for medication delivery. Be aware of medications that are hazardous when crushed or aerosolized. Some medications may cause harm to the person crushing it due to hazardous exposure of aerosolized or dusty particles. These particles could be teratogenic or allergenic. Closed systems are required for safe preparation along with appropriate personal protective equipment, PPE, gown, masks, and gloves. The 5 rights of safe medication administration are fundamental principles designed to ensure the correct and safe delivery of medications to patients. These rights focus on giving the right medication at the right dose to the right patient through the right route and at the right time, helping to minimize errors and improve safety in healthcare settings. Preparing a clean and organized area is important for safe and effective medication administration via feeding tubes. Following hand hygiene, set up a clean area to place medications and supplies. Supplies might include the specific medications that are prescribed, purified water, such as distilled or sterile water, and may include additional supplies as needed, such as clean medication cups, end-fit syringes, syringe caps, medication straws, crushing tools such as mortar and pestle, and a clean cloth or towel if used. Consider placing a clean cloth or towel under the connections to lower the contamination risk and to prevent spillage on the patient. Clean gloves and other PPE are used as needed. Hand hygiene. Wash hands for at least 20 seconds or rub hand sanitizer until dry. Clean gloves should be worn if institutional policy recommends, but may not be necessary for individuals or caregivers to use in the home environment. If clean gloves are used, ensure that they have not been used for any other tasks or procedures. If medications are not prepared in the pharmacy, they should be prepared just before administration and individually. A mortar and pestle or manual or electric pill crusher device may be used to crush appropriate immediate release tablets to a fine powder. Be sure to clean the device with water in between medications. Use purified water, such as sterile water or distilled water, or medication dilution to prevent interactions that could occur with minerals and contaminants in tap water. Use a separate cup for each medication and then dilute and stir with purified water as recommended for proper gastric or jejunal feeding tube administration. Some tablets, such as oral dispersible or disintegrating tablets, may be dropped into an end-fit flush syringe and allowed to dissolve after purified water is drawn into the syringe. Ensure that the tablets or capsule contents are sufficiently diluted so there are no visible clumps or particles. If liquids or suspensions are used, they typically require dilution with an additional purified water to lower osmolality and viscosity. If approved for feeding tube delivery, gelatin capsules may be pricked near the tip with a needle or pin that has been cleansed with alcohol and then gently squeeze the capsule to release the liquid. Prepared medications may need to be mixed or shaken immediately prior to the administration if particles have settled out of the solution. Ultimately, it's essential that these particulates are diluted adequately so that they do not form clumps or clog the tube, which can make it unfunctional and cause harm to the patient and increase cost to the patient. Appropriate patient assessment and preparation is essential for safe administration of medications via feeding tubes. The first step is performing hand hygiene and donning appropriate personal protective equipment, PPE, based on the risk exposure to bodily fluids or infectious precautions. Introduce yourself to the patient and verify the correct patient using two identifiers. Gather and review physical assessment and laboratory data that may influence medication administration, such as the most recent weight, the recent vital signs, and results of renal and liver function studies. Determine whether the patient has had fluid restriction and discuss alternatives with the practitioner or pharmacist. Assess the patient for specific contraindications to receiving the prescribed medications and advise the practitioner accordingly. Verify the patient's actual admission weight in kilograms and reweigh the patient if appropriate. Actual weight is the preferred measurement strategy as it is most accurate. Obtain the medication and check it against the practitioner's order. Verify the expiration date, check for allergies, interactions, or duplications, and check that the medication and container are clean and intact. Do not use medication that is cloudy or precipitated unless it is indicated or appropriate for that medication. Verify the correct patient using two patient identifiers. Patient identifiers typically include patient name, medical record number, social security number, last four digits of the social security number, and/or date of birth. Wristband barcode scanning is commonly used to enhance safety in inpatient settings. Barcode scanning to ensure safe medication administration to the right patient, providing the right therapy via the right route at the right time and frequency, is advocated by organizations such as the Institute for Safe Medication Practices, or ISMP. Verify tube placement before medication administration. Verify that the tube has been approved for use and that the providers have confirmed its correct position via X-ray or radiological confirmation. Trace the enteral tube back to the patient's insertion origin to prevent an inadvertent misconnection. Label the feeding tube per the organization's practice. And verify placement of the enteral tube per institutional protocol using one of the following: measurement of the visible tube length and comparing it to the confirmed initial measurement and length, visual inspection of the gastric aspirate if obtainable, pH testing of the gastric aspirate, and capnography CO2 detection as per institutional policy.
Hold or stop tube feedings during medication delivery. Some medications require that tube feedings be held for a period of time before and after medication delivery, for example, 1 to 2 hours before and after, to improve drug bioavailability. Consult a pharmacist or medication resource for guidance on holding tube feedings. See the resources that are included. If tube feedings are interrupted for extended periods, it may be necessary to adjust the rate, volume, or schedule of the feeding administration to ensure that the patient's daily nutritional needs are met. A dietitian consult may be helpful. If holding tube feeding for extended periods, document in the designated area of the health record, including the medication administration record and/or the intake flow sheet. Document the exact amount of tube feeding formula given so that the healthcare team is aware of the nutritional therapies that have been administered, held, or not given within the 24-hour period. Water flushes. Manually flush with at least 15 milliliters of purified water by a syringe before and after each medication, with a minimum of 15 milliliters of purified water flushed between each medication. This amount may be lower in pediatric or fluid-restricted patients. Water flushes are necessary to clear the tubing and prevent any interactions between gastrointestinal contents, formula, and the medications. Purified water, for example, sterile water or distilled water, is used to prevent medication interactions that could occur with minerals or contaminants in tap water. Water flushes are also necessary to ensure that the medication is delivered to the distal end of the feeding tube and then into the patient. There are 4 methods described here for administration of medications through feeding tubes. Each of these methods should begin by turning off the feedings, and then once the last flush is given, turn them back on unless otherwise ordered. These include the syringe gravity flow method, the syringe push method, the tablet drop method, and liquid medications from bottles containing a medication cap. Supplies needed for syringe gravity flow method include prepared medication or medications, 60 ml ENFit syringe, purified water, cup for the water, clean gloves, and hand sanitizer. Here are the steps for the syringe gravity flow method.
This is the syringe gravity flow method. Uncap the syringe and remove the plunger. Using the barrel as a funnel and holding it upright, attach it to the feeding tube. Unclamp the feeding tube. Pour the purified water flushes and prepared medications one at a time into the barrel. Start with a purified water flush to clear the tubing, then pour in each medication separately with a water flush in between. Ensure each water flush and medication has emptied from the barrel prior to pouring the next solution. End with a purified water flush. Clamp the feeding tube and remove the barrel. Cap the feeding tube.
Supplies needed for the syringe push method include prepared medication or medications, 30 or 60 ml ENFit syringe, medication straw, purified water, cup for the water, clean gloves, and hand sanitizer. Here are the steps for the syringe push method.
This is the syringe push method. Draw up purified water into the flush syringe. You may draw up enough water for the flushes before and after giving the medication. Draw up the medication. Using a medication straw with ENFit syringes keeps the ENFit connectors clean. Attach the medication straw to the syringe, draw up the prepared medication, and remove the straw. Attach the purified water flush to the feeding tube, unclamp it, and instill the purified water flush to clear the tubing. Clamp the feeding tube, remove the syringe. Attach the syringe with the medication to the feeding tube, unclamp it, and instill the medication. Clamp the feeding tube and remove the syringe. End with a purified water flush. Unclamp the tube, then clamp the tube, remove the syringe, and cap the feeding tube.
Supplies needed for the tablet drop method include prepared medication or medications, 2 30 or 60 ml ENFit syringes, purified water, a cup for the water, clean gloves, and hand sanitizer. Here are the steps for the tablet drop method.
This is the tablet drop method. Uncap the syringe, remove the plunger, and drop an oral disintegrating tablet in the barrel. Replace the plunger, positioning it towards the tablet, leaving a little air in the syringe. Draw up the recommended amount of purified water. Cap the syringe and allow the tablet to dissolve. Shaking the syringe may speed up the process. In a separate flush syringe, draw up purified water. Attach the water flush to the feeding tube, unclamp it, and instill the water to clear the tubing. Clamp the feeding tube, remove the syringe. Remove any residual air from the syringe containing the medication. Attach it to the feeding tube, unclamp it, and instill the medication. Clamp the feeding tube and remove the syringe. End with a purified water flush, unclamp the tube, clamp the tube, remove the syringe, and cap the feeding tube.
Supplies needed for liquid medications from bottles containing a medication cap include prepared medication or medications, two 30 or 60 ml infant syringes, purified water, a cup for the water, clean gloves, and hand sanitizer. Here are the steps for administering liquid medications.
This is the method of liquid medications from bottles containing a medication cap. Apply an adapter to the medication bottle so an end-fit medication syringe can be attached to it. Invert the bottle and pull back the plunger in the syringe to the desired dose. Remove any air bubbles. In a separate flush syringe, draw up purified water. Pinch and uncap the feeding tube. Attach the purified water flush to the tube, unpinch it, and instill the water to clear the tubing. Pinch the tube, remove the syringe. Attach the syringe containing the medication to the feeding tube, unpinch it, instill the medication, pinch the tube, and remove the syringe. End with a purified water flush, unpinch the tube, pinch the tube, remove the syringe, cap the feeding tube.
Rinsing of medication cups. Cups used for preparing medication should be rinsed with purified water and the rinse administered via the feeding tube to ensure that the full dosage of medication is delivered. After medication delivery is complete, remove the plunger from the barrel of the syringe. Rinse the barrel of the syringe and the plunger with water. Do not use soap or any other cleaning products. Dry the syringe pieces with a paper towel or allow them to dry separately between uses to lower the risk of bacterial contamination. Syringes used for medication delivery may be reused within 24 hours or per institutional policy, or over a few days in the home setting as long as they are kept clean and dry and working properly. Store the syringe pieces on a clean, dry towel or in a clean, dry container. Conduct post-medication administration documentation and monitoring. Document each medication administered, including the name, the dose, the time, the route, and the milliliters administered in terms of volume in the MAR and the associated flow sheet rows per facility policy. Document the volume of water given with medications in the intake flow sheet per facility policy. Each medication that is not administered, for example, if the patient refused it or the dose was missed, or for any other reason, including comments, and notify the prescribing provider per facility policy. Individuals or caregivers in the home care setting may find a medication delivery and water flush log useful to track daily medication dosage and water amounts administered. Monitoring. Report any issues related to medication tolerance, allergic reactions, therapeutic effect, ease of preparation, ease of feeding tube delivery, or issues with tube clogging to the provider. Communicate with the ordering provider when the patient can safely swallow or when the feeding tube is scheduled to be removed to assess whether the medications can be converted to the oral route. Here are references for this video.
This video series was provided to you by ASPEN in collaboration with the University of Rochester Medical Center and supported by Cardinal Health. We also wish to thank Tammy Cullen, RN, for her assistance with the medication preparation video clips.